Probably the most common phrase I hear is, what would you do? What would you do for your family member? And, I try to sit back and really say, it comes down to all the different factors that are important to each individual person. And I talk through that with patients. There's pros and cons to everything that we do. As a physician, if I, feel the person is high risk, and they're going to require more aggressive treatment, I sort of feel confident enough to talk through that with them. But I really feel like we need to address their concerns, make sure that they also understand why we have such a high concern. A great example would be there was a time when a mechanic called me after hours one time and said, I'm worried about your brakes. I couldn't stop thinking about your car after work. As a physician, we go through the same thing, thinking about that patient, feeling like they're high risk, and always wanting to do the best we can for them. It needs to be a process that engages someone in it, and that we try to provide answers to all their questions, make sure they feel that they are part of the team in that decision making, and that if there's sort of any discomfort, or if someone feels they want to take a different path, that we talk about the safety and the effectiveness of all the different options available.
Most of my colleagues often ask, what are you taking, and whether it's their medical assistants or their nurses, or if they're asking specifically, a lot of times they will ask, but patients oftentimes, what we're finding, don't actually tell them everything that they're taking. And so it's really important for us to, as a patient, to really explain to everybody what they are taking. Because if you're taking something that interacts with another medication, it's important that you're not taking that supplement or that vitamin. The other piece is that a lot of people are recommended to take certain products, whether they see it on TV or in an ad or from somebody at the health food store. And a lot of times they're taking more things than they need to, and so they're wasting their money. And I think that there's ways that you can focus that money in to take something that actually will really be helpful for you. And there's a lot of products out there too that don't have what they say they have in them. And so I think that's another piece to think about as well.